This podcast is sponsored by Great Seminars and Books. Have you ever thought about how we can become leaders in geriatric care, or how we can break out of the silos of rehab to serve older adults to the best of our ability? Well, myself and Dr. Carole Lewis of Great Seminars and Books will be holding a free webinar titled Breaking Out of the Clinic, Strategies to Become Leaders in Geriatric Care. This webinar will take place on October 9th, 2017 at 7 p.m. Eastern Standard Time. To get access to this webinar, just go to seniorrehabproject.com/great. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Hi, everybody. I'm Tali.
I'm Erin Kerry.
This is the Senior Rehab Podcast.
Shorts.
Today, we're going to speak about an article that has to do... This time is something a little close to my heart because most of the things that I want to treat are not necessarily things that I see in the clinic, is things that I see in the street with people that don't come to the clinic or to get any care, but you just see elderly people walking down the street. You're like, this is such a full risk.
Can you give an example?
Let's say that you see someone who doesn't really know how to use the cane.
Oh, yeah.
Or you see ill-fitting shoes.
Yes.
Or like I'm going to say right now, and this is the article we're going to speak about, when you see an extremely kyphotic back.
I saw like 4 today on the way home.
And there are some people that it's not postural, but actually this is already their structure. And you can see that they look at the floor, literally.
So Tali, what's the name of the article?
So the name of the article is Exercise for Improving Age-Related Hyperkyphotic Posture, a Systematic Review. It was a review article or meta-analysis.
When was it published?
It was published in 2014.
What journal was it published in?
It's actually from the Archive of Physical Medicine and Rehabilitation.
Fancy.
It was endorsed by the American Congress of Rehabilitation Medicine.
Cool.
And I'm going to go a little bit of where they got the articles that they reviewed from, and they did something that I really like, and they didn't just go to PubMed or any of,
CINAHL.
Yeah.
EBSCO.
Yeah, they did that too, but they also went for things that were presented in Congress or...
Oh, like things that would be at CSM for physical therapists?
Exactly.
That's really cool.
Or things that were presented in the American Society for Osteoporosis.
That's sweet.
So their objective was to evaluate previous research to determine if exercise can improve pre-existing hyperkyphosis by decreasing the angle of thoracic kyphosis. Most people in the study are a little bit younger than what we are expected to see in geriatric population.
What's the mean age?
The mean age is around 60, something like that. But the cutoff to get into the research was 45.
That's really young.
But all of them are post-menopause.
What?
If it comes to women. Yeah. I don't want to jump to the bottom line right now. Mark that in your mind, okay?
Okay.
That like extreme...
Yeah, that's a huge range.
Yeah.
Yeah.
Mark that in your mind about this article that reviews other articles.
Okay. Marked.
The data sources were search for studies related to posture exercise and age 45 and above in PubMed, Embase, and Index of Nursing and Allied Health literature, and also online conferences like the American Society of Bone and Mineral Research, American Physical Therapy Association, Gerontologists Society of America.
I have a question about that.
Yeah.
So there's no database that I'm aware of all these different conference proceedings. Like, does that mean that they went to like the APTA website on CSM and just Googled the different talks? Or like, how did they find the information for this from those specific talks?
That's a very good question.
Thank you.
I thought the same thing of like, did they just go to all those conferences? Did they ask someone from the APTA, send us all this thing? That part they didn't really talk about. They did say, and in the end, there's an appendix with all the awards they used.
Okay.
which I kind of liked. They said exactly which words they use and what they
And their
search
search
for.
terms.
Yeah.
They have to, as per the Prisma guidelines.
I know. I know. A friend told me.
Yes.
But yeah, that's a thing to think about.
So I think about it because I've looked for information on presentations before and tried to find like the source material or even just like a packet of the lecture slides. It's impossible. It's kind of ridiculous, honestly.
I know with like CSM, they keep it for a little while.
Yeah, but you have to be an APTA member to get that.
Yeah.
And like, so if I want to look at something from Indianapolis, however many years ago that was, I'm not going to be very lucky.
Mm-hmm. Study selection, 2 independent reviewers screened titles and abstracts and selected studies that tested the effect of exercise on measures of kyphosis or forward head posture in individuals with hyperkyphosis at baseline. It was defined as an angle of more than 40. There's a difference between forward head posture and hyperkyphosis.
I mean, doesn't one lend itself to the other?
It is, but sometimes you can have a forward head posture that is actually a little bit more flexible.
Oh, like I'm thinking about kids slouching over their computers. They can move their heads back if they want to because they're malleable children.
There are, and it is a little harder when you're already an adult, and
right,
and probably your postural habits has
solidified.
But the question is it something that is fixable with a chin tuck?
I see. Okay, so
what is the source of?
Like, is it bony or is it soft tissue? Mm-hmm. Okay.
Direct surgeon, they used the pilot-tested abstraction form. The Cochrane collaborations tool for assessing risk of bias was used to assess the methodology
of the search
of each article they found.
The source material.
Yeah. Exactly. In the end, they found about a little bit more than 1,000 things. It often comes down to less than 20. They got to 13. It's not a lot. And that's what I want to go here in the article. And that's one of the things that I like, articles that are not bombastic. There's like no new word from that. In the end, the results and the conclusion from that article is that our research is not good when it comes to kyphotic older people. Not
good, like the quality of what's available is just garbage, or not good, like we don't have anything?
Both.
Well,
so out of
not good.
Those 13 things they used, it's actually 12 because one was actually a follow-up of another article they included.
Oh, using the same population?
Yes.
Okay.
So they actually set it as 12 articles.
Okay.
Out of that, only 7 were RCTs.
Okay. What were the rest?
Was pre and post. Out of the 7 RCTs, only 4 had between group comparison.
Really?
And not just what happened before and after. So only 4 had the between group comparison. And out of the 4, only 2 were really, you could really understand what exactly they did when it comes to times. One of them was for 2 years, they gave them 5 days of exercise.
What?
Each week for 2 years. I don't know anyone that would adhere to that.
Absolutely not.
I wouldn't.
No. That would be so boring.
Yeah. And one was a yoga.
Oh, that's fun.
And was less than 24 weeks.
I could do yoga for 24 weeks every day.
Yeah. It wasn't for every day. It was for 3 days.
No,
I can do 3 days
totally
of yoga
doable.
For a little bit less than half a year.
Yeah.
So in the end, that's actually it's a little bit devastating because when you think about it, so many people complain about that problem, the hyperkyphotic. They not necessarily would complain about that, but you can see that it bothers them.
Yes.
Both aesthetically, both in the risk of compression fractures.
Right.
The risk of pneumonia.
Yeah.
And other pulmonary problems. Risk of falls. In women, it's one of the higher things for fall risk.
Oh, I didn't know that. I definitely know when I am walking around and seeing these it's usually older women who have their rollators or their carts, and they're just looking at the ground because they can't look up, and it hurts. It would be nice if there was something that we could do about that.
It would be, and I think that there is research about it, and we are trying to do something about it. But I think that this review has pointed out something that we need to also have quality research about that, and not just research.
Right, like 2 out of 1,000 being something that we can actually pull good information from is pretty unacceptable.
There were other things that you can pull good information from. I am a big fan of case studies. I think it's where we actually start and innovate. In the end, yes, we need the RCTs.
I tend to see case studies and I'm like, meh.
I know.
I shouldn't do that.
I think it's good that you're skeptical about...
I think I take it a little too far. I'm like, garbage, I don't care.
I don't care, one person.
Put that case study away. Get it out of my face.
But AIDS was the first, just a series of case studies.
That's true.
Parkinson's was at first just somebody, Dr. Parkinson, sitting in a cafe in London and seeing people walking down the street with a weird shaking palsy.
Wait, is that real?
Yes.
You didn't make that up?
No, I didn't make that. Why do people think that I make up stuff?
Because that's so specific. Like, first of all, I had no idea Dr. Parkinson was English. Second, he sits in cafes and watches people walk by. A little creepy.
Well, yeah. But considering that most of medicine is based on creepy people saying, I can cut a body and find things, I will let him, he kept his subjects alive, so fine. Anyhow, what I want to say, and just to get a little bit to the articles, things that had some proof of being efficient, that, the 2 articles that were very efficient was the back extensors strength and the yoga. Now, about the back extensor strength, which is one of the things that a little bit of a pet peeve, I think that I got from one of my old CIs somewhere 7 years ago, is that I remember I wrote in a goal, should strengthen quadriceps. And then he looked and he said, did you examine the quad strength? And I'm like, yes. So why didn't you write that? None of them wrote that they actually checked that the back extensors were weak.
What?
Why do you strengthen something that you didn't check was weak?
That's hilarious and sad.
So I would love to see if any of the listeners have quality studies about hyperkyphotic elderly people and treatment of those people, please let me know. It's one of the things that I would love to see quality study about and work on, because I think it has a lot to do with the self-esteem of our patients. Any questions or things that you have to say?
I want to do a summative comment. So this is a systematic review from 2014 looking at patients with hyperkyphosis and seeing what treatment interventions could potentially help reduce the hyperkyphosis. And they define hyperkyphosis as 40 degrees?
Mm-hmm.
Okay.
Now, it wasn't actually what can help the hyperkyphotic. It says, would exercise help it?
Okay, so the question was, can exercise help reduce hyperkyphosis in adults over the age of 45?
Yes.
Okay. And they found that maybe?
They found that it seems like it, but we really need quality study to say that.
Yes. So those 2 studies that were actually pretty good quality, how much of a decrease in the kyphosis did they find?
Around 3 degrees or something like that.
Okay. So not a lot.
No, it was significant, though.
Okay.
Yeah, it was significant, and I want to say that not only 2 were RCTs. I think the pre and post were also good quality. Some of them were good quality, but out of the 12, only 4 were rated high quality, and the rest were...
Was the quality from the Cochrane thing that you were talking about? Okay.
Exactly. So other things that a little bit in the preview, they say that they are usually used for the hyperkyphotic is surgery, which is indicated only if it's compression fractures and things that are really dangerous.
That's relative.
Like no, I mean like
But I see what you're saying.
No sensation in your
right, like cord compression.
Yeah, exactly.
Right.
Cord compression, spinal stenosis.
Yeah.
Other things like that, and corsets that are sometimes indicated, and exercise. So those are the three big things that we in medicine use for hyperkyphotic in elderly people. And
right now we know that exercise might help.
Yes.
Okay.
Mostly the back extensors.
Which would make perfect sense. Yes. So there hasn't been anything published since 2014 about this particular topic, or there wasn't anything that was worthwhile?
I didn't find anything that was worthwhile.
Yeah, it was all like, and we made her back straight because voodoo.
No, it wasn't. It really, really wasn't. I read both case studies and post and pre, but I didn't find any reviews.
Okay, so this is the most up-to-date systematic review on this topic. Okay.
That I could find.
Yeah, I trust your search skills. I know you're a pretty efficient Googler.
Oh, thanks.
Put that on your resume. Efficient Googler.
I can type things into Google and it gives me answers.
Is there anything else you want to say?
We love hearing from you. We love talking to people and not just doing what is only interesting to me or what is only interesting to Erinn.
Right. We like your input.
We really do.
Thank you all for listening to this episode of Senior Rehab Podcast Shorts. If you have any questions, comments, if you have any articles that you want to share with us, please email us. My email address is Erinn, Erinn, that is, yes, that's 2 N's, at geroscollective.com. And Tali's email address is Tali, Tali, at geroscollective.com. Send those along, and maybe we'll talk about them on the show. And, as always, stay funky.
Hit me! Thank you for listening to the Senior Rehab Podcast. If you enjoy this content, I highly encourage you to go to seniorrehabproject.com, where you can find more helpful episodes, lots of free resources, and to see how you can become a game changer and influence the direction of this movement. I appreciate you, and I'll talk with you soon. But in the meantime, do not forget to stay funky. This podcast is sponsored by Great Seminars and Books. Have you ever thought about how we can become leaders in geriatric care, or how we can break out of the silos of rehab to serve older adults to the best of our ability? Well, myself and Dr. Carole Lewis of Great Seminars and Books will be holding a free webinar titled Breaking Out of the Clinic: Strategies to Become Leaders in Geriatric Care. This webinar will take place on October 9th, 2017 at 7 p.m. Eastern Standard Time. To get access to this webinar, just go to seniorrehabproject.com/great. This podcast is brought to you in partnership with the Geros Collective, a podcast network that's redefining old and equipping healthcare clinicians to better serve our aging population. Find out more at geroscollective.com.